Good afternoon. My name is Martin Hines. I'm Mayor of the City of Tyler. Thank you so much for all the media outlets being here today. I would just like to inform everyone that is watching that we are practicing social distancing. The reporters are all spread around the room, so there's different angles, and our speakers are also limiting our room to 10 people in this room at this time. I'd like to say, while you have not seen me in public really make any statements relating to this, I want you to know that we started an extensive organization at the end of February where we had informal, very important discussions about the pending COVID virus issues that could be coming throughout the country. And then on March 16th, we started the Joint Emergency Operations Center, which we refer to as the EOC. That is the organization of City of Tyler, Smith County, leading the Joint Operation Command, Tyler Independent School District, Net Public Health, EMS, State Rep Schaefer, UT Health, Christus Health, Smith County Medical Alliance, Baylor Scott and White, and about every state agency that is involved in emergency issues is also with us. We're practicing social distancing during these meetings. We have 10 people in 2 rooms and approximately 40 people on the phone every day from all these different entities. And that is, the command center stood up about 9 days ago. I'd like to say on the city side, we have 18 city employees and elected officials directly involved in the EOC operations, and we have 7 other employees indirectly involved. The main focus of the emergency command center is that we brought all agencies together. I've lived in Tyler many years, and I've been a city councilman and mayor for 10 years now. I have never seen these organizations working together the way that we are. And I'm happy to report, after thousands of man-hours worth of work on the part of the city, the county, your hospitals, your Northeast Texas Public Health, your school district, we are all together and we are ready for this crisis. Whichever turn it may take, we are ready and we're prepared. Each of your channels will be receiving a PSA on what we need to be doing. And the main thing is that PSA is going to have a phone number for Christus Trinity Mother Francis and UT Health. That is the number that someone that feels that if they are ill, they need to call that number before presenting themselves to a clinic or to an ER. It's so important because we have to protect the healthcare workers, because if this does become a longer issue in the community, we have to maintain their health. We have protocols for EMS, we have protocols for first responders. And by the way, that emergency command is not just the city of Tyler and Smith County participating, right? I mean, we have mayors of all the towns around here are participating. It is an extensive network of every professional that we needed to put together. It is, I can't tell you how incredible the collaboration is. We have people from every entity helping out other entities. When the health department needed some extra folks to help them on certain items, the planners and the logistics, we were able to have some Smith County employees and some City of Tyler employees fit into those slots. So I just want to let you know how critically important the last several weeks of planning was in your community. And so now we're ready, but now we need to make sure that we're communicating to the public some very important items. And The media outlets are how we're going to reach. And as y'all know, in the media, we have a joint information group that works every day from every one of the entities. We probably have 15 or 20 entities where their PIOs are working together to make sure that we're getting good factual information out through the media to our public. And that will continue and increase as we go through the next several weeks. I do want to start with another issue, really. And that is, I want to be very clear. We are working with the healthcare. It is not just a bunch of elected officials. We have great professional employees, but the Northeast Texas Public Health and the hospitals have been incredible. The Smith County Medical Alliance is on every phone call, and they are communicating with all the independent physicians in this area. We have great communications, and without the hospitals and the Northeast Texas Public Health leading and helping describe the issue so us as a command center and elected officials can communicate, we can't do it without them. And Dr. Levine and George Roberts will be speaking later because they are critical in this process. One thing that I have learned, and we all are watching the national media and getting all these reports, right? Tyler and East Texas have always had an attitude that we care for one another. The nonprofits, the faith-based institutions, that is what makes our community great. In this time of need, we have to do something a little different. Caring for the elderly might mean for grandma and grandpa, I know you love them. Don't go around them. Please, we have to socially distance ourselves. We are working very hard as an organization to work on contact tracing, and we'll have a speaker to discuss that. But we have to take the personal responsibility to stay 6 feet away from everybody. So when you, what I'm requesting, this is a request, and it is shelter at home. Please stay home. There are certain items that you're going to need for your daily life. The services are available in Tyler for you to do that. But please, let's not have social hour. Let's really practice what we know inherently, that if there is anything that I'm told from the public health is social distancing, clean surfaces. Clean surfaces, social distance, and wash your hands. Yes, thank you. Sorry, I've said it so many times, I get it out of order now. I've said it so many times. But we know that as a community, we have the power within ourselves to make sure that we are not spreading the disease to your neighbor. And that's where it goes back to the caring community that we are. Care for your neighbor now. Be careful. Do the social distance. We're not asking this to be a lifetime choice or a lifestyle choice. We're asking for the next several weeks, let's be cautious as a community. We are also making requests, and the city manager will be discussing some of these requests for the businesses in our community. While Tyler is not just servicing Tyler. There's a lot of people that come in Tyler in and out every day. What we're requesting is that the businesses help us through good corporate business responsibility to make sure they're social distancing in their stores. There's some examples of some great corporate citizens. Brookshire's, for example, has an hour for the elderly population. Those are some creative ideas that we all need, but we also, when we're in those stores, we need the businesses and the retailers to help us make sure that there's not 20 people in a line right next to one another. We need to just do very practical things in caring for one another. That's what we're in for. And at this time, I would like to introduce Ed Broussard, City Manager of the City of Tyler. And then it'll be Nathaniel Moran, and Dr. Levine, and George Roberts, and then I'll come back for questions.
Thank you, Mr. Mayor. My name is Ed Broussard, City Manager for the City of Tyler. As the Mayor was emphasizing, we are dealing with a highly infectious disease that is spread by just as far as people being in close contact with each other. On a personal story, I have 7 family members that live in Germany. 6 of those 7 have already been confirmed cases of COVID-19. This spreads incredibly quick, and it spreads amongst people very fast. One of the things that we are trying to emphasize here in our community is that for a number of different places you're going, especially our retail, our commercial businesses, those as far as industries where people are working, they have to do their work in making sure that there is social distancing, and also as far as keeping people apart and crowd control in their locations. We have the police department that are visiting various big box retailers and working them on compliance through the governor's order. We've visited several different, as far as big box retailers yesterday. I'll give you an example of one that's actually doing an incredible job of where they have no more than 100 people in the store at any one time for their large big box location. They are doing crowd control, so there's one access point in, one access point out. Making sure that there is social distancing occurring throughout the store and as people wait in line to get into the location. But we also visited other big box retailers where people were, while they may have been speaking on the speakers encouraging it, people were very close to each other. People were, as far as interacting with each other and not practicing as far as the type of social distancing and limitations that was required under the governor's order from last week. So we are working with them to try to explain the need for this and asking for all retailers to protect our public and their customers in regards to the actions that they're taking to ensure that there is social distancing and a limited number of people in their facilities at all times. We're also working with the Tyler Area Chamber of Commerce and the Tyler Economic Development Council to make sure we are continuing to get information out to our businesses and industries on what they need to be doing to meet the governor's order in relationship to social distancing and the limitation of people in a room at one time. This is one to where we are putting out information, making sure also they understand this isn't just a request from the community. The governor's orders provided as far as fines and or criminal penalties that can go with this if there is not compliance. We, of course, always look to see how we can come up with voluntary compliance before we have to use the heavy hand of government. But this isn't as far as just guidelines that are being put out there. This is a requirement, and we are taking this seriously. With that, I'll turn it over to County Judge Moran to talk a bit about as far as Smith County and some of what's going on in that area.
Thank you. I appreciate the opportunity to once again be here to address the media and the public on this very serious matter. First, I want to say how happy I am about the effectiveness and the exemplary organizational behavior of the joint EOC that's been established by the City of Tyler and Smith County operations. You would not believe how much we have gotten done over the past few weeks, meeting together, sharing information, making joint decisions, and communicating about how the best way is to approach this particular pandemic. In particular, I'd like to point out the exemplary efforts of Chief Coble and of Smith County Fire Marshal Jay Brooks. Together, they have led that team on a day-to-day basis and have done an outstanding job doing so. The incorporation of medical information during that time frame and discussion among the professionals in the room to determine and to gather all the information and then make joint decisions has made this a much more smooth process than it would have been otherwise. I served on the City Council from 2005 to 2009 here in Tyler and have been the judge now in Smith County for about 4 years. And I will echo what Mayor Hines said. In that time frame, I have never seen cooperative effort between Smith County and the City of Tyler, the ISDs, the outlying cities, as I am seeing here today. It's outstanding, and I applaud their efforts. Second, I would like to say I have the utmost faith and confidence in our medical community and our hospital systems to meet the needs arising from COVID-19. These professionals are second to none in the state of Texas and across the nation. We are blessed to have a medical system in Smith County that can meet the needs arising from this COVID-19 crisis. And I applaud their efforts, and I applaud their preparation, and I have the fullest confidence that they will meet any need that arises. Third, I'd like to say again, you need to take this virus very seriously. And I want to assure you that we at the county and at the city have been taking this matter seriously for a number of weeks. I spoke extensively yesterday in Commissioner's Court about the things that you heard today from the city manager and the mayor about the day-to-day activities that have been going on, the meetings, the information gathering, the decision-making process, and in particular, I want to emphasize again, the coordination with the medical professionals and those that understand this virus from a medical standpoint to help guide our policy-making decisions. Next, I want to reemphasize this point that I've made a couple of different times, and that is the exercise of personal responsibility is really the best way to ensure the continued liberty of individuals in this community throughout this time. It may be necessary in the future to put further restrictions and mandates in place by order as a result of what we're seeing in the community. If and when that time comes, through consensus decision-making, through this joint EOC and in collaboration with advice from medical professionals, I will not hesitate to put in place any order that's necessary. As a county judge, I understand that's my responsibility at the county level, and I take that matter very seriously. Before we get to that point, however, and even after we get to that point, there is no substitute for exercising due diligence in our individual and our personal lives. Hand washing, keeping your distance, and loving and respecting your neighbor, following that principle at all times, is the best way to keep each other safe. That is one of the two base and core biblical directives that we have. Love God and love each other. At this time, the best way to love one another is to show respect for those that are the most vulnerable, especially by keeping our distance, by socially engaging in appropriate activities at home rather than out in the community, and by making sure that we are washing our hands at every instance we can. Let me conclude by saying again how much I appreciate the mayor and the city manager and the activities of the city of Tyler and their cooperative and collaborative efforts with Smith County. They have been stellar throughout this process. Their wisdom and their guidance have been invaluable to making the correct decisions as we go forward. We are going to do our best from this point forward to continue making those good decisions. And we wish each person in this community the very best and urge them to heed these warnings and to stay safe. Godspeed.
Good afternoon. My name is Dr. Jeff Levine. I'm a public health physician, and I'm in service to the community as the Smith County Local Health Authority. I'd like to begin by thanking the Mayor, Mr. Broussard, Judge Moran, for their earlier comments and their leadership role in the efforts that are underway. And I would like to also thank the media for the very responsible way in which they're reporting factual information about the conditions and circumstances which we're currently experiencing. You've heard a great deal today about social distancing, so I want to keep my comments brief by talking about 2 points. One is about social distancing, and the first thing I'd like to do is be sure to reiterate and encourage the words that you've already heard and follow the direction of the health community and our elected officials in terms of complying with the social distancing comments that you've heard so far. Why is this so important? I'm sure that many of you have heard that we're in a phase of this current circumstance that we refer to as mitigation. And in straightforward terms, what that means is we are making every effort at this point through social distancing and other measures to keep the number of cases that are occurring on a daily basis from growing, and also to reduce the rate at which they are growing. That's a very, very important thing to understand, which again, some of you may have heard of as flattening the curve. The reason that's so important is really leads to my second important comment today, and that is the role of the medical community at large working together in order to continue to prepare itself to manage individuals who may become symptomatic from this condition, and especially those individuals who may need to go into the hospital or receive much more advanced care. The better we are able to do that in a systematic way and in a way that the medical community, despite its considerable resources in this region, without becoming overwhelmed, the better the medical community will be able to serve everyone here and ensure that we have the best outcome from circumstances which up to this point are very much out of our control. They are in the control of the virus at this point. So with that, again, to summarize my 2 key points, please heed and listen to what you've heard about this social distancing issue in a very responsive and responsible sort of way, as you heard expressed earlier. And please be very patient with the medical community. They're working very hard right now in order to be prepared, continue to be prepared, and to ramp things up in a way that they can be responsive to perhaps less serious needs or concerns, and those needs, serious needs that are very possible to emerge as a result of what we're experiencing. So with that, I'll conclude my comments. Thank you.
Good afternoon. I'm George Roberts, Chief Executive Officer of the Northeast Texas Public Health District. First of all, thank you. Thank you to the media for being here today, for continuing to talk about this in a way that our community can understand this. I also want to say thanks, echo the thanks that's been mentioned. I first thank Dr. Levine, who just spoke. Dr. Levine has worked tirelessly as the Smith County Health Authority to advise not only myself and my organization, but also the Smith County and the City of Tyler. Our Emergency Operations Center has been functioning very well. We have had numerous discussions. We've been meeting 7 days a week, and not only as a full EOC, but also as the executive committee of that group. We've worked tirelessly to try to make sure with the number one goal is to protect the citizens of Smith County and even beyond in some cases. So I say thanks to that. So thanks to and also thanks to our incident commanders, our Chief Cobble, and also Marshall Brooks, as well as the work of the mayor, the city manager, and the Smith County judge. Also, my team at the Northeast Texas Public Health District has been working tirelessly to handle this situation. So my eternal gratitude goes out to them as well. This is a team effort today. And why do I say team? Because there is no vaccine for this COVID-19 as of yet. There's no medicine to take for this situation. All we have is each other to limit the spread. So said again, all we have is each other to limit the spread. So again, you've heard that. I'm going to hit the high points again. Social distancing. We also talk about washing your hands for 20 seconds, keeping your hands off your face, staying home when you're sick, and staying away from sick people. Again, the symptoms of COVID-19 are a fever, a cough, and shortness of breath. If you have those symptoms, please contact your health provider and determine if you need to be seen. But call your healthcare provider. Don't just show up at the door without telling them you're coming. Alert them and tell them you're coming so your provider can be dressed in proper protective equipment to handle your situation. So again, a team sport. Thank you for all you're doing in this community right now. And again, all we have is each other in this situation. So please be mindful of the things that we've discussed, each of the five of us that discussed here today. And at this point, I think we're happy to answer any questions you might have. And the way we'll work this is that we'll answer questions, and everybody is sitting behind this room, so we'll be happy to answer questions that you might have.
George, have there been any COVID-related deaths in Smith County?
Yes, there have been. There's been one related death. We're going to be pushing that out today. As a matter of fact, it's a 91-year-old male who is a Smith County resident.
How many cases are we up to?
16.
Is that counting it up?
That includes that the person is, good question, so make sure you're not double counting here. 16, the one death is included in the 16.
When did that death occur?
I believe I think it either happened late last night or early this morning.
Was it at a hospital or at home?
I believe it's in hospital.
Did that person have pre-existing conditions?
Oh, I don't know the answer to that. I just know they're, again, 91-year-old male.
How many tests does the public lab run?
The FLET lab, I think the Public Health Lab of East Texas, I'm going to give you state numbers here. According to the Department of State Health Services website, there's been 1,758 public health lab cases across the state of Texas. I believe we've tested almost 300 patients here with the FLET lab of East Texas.
Is the lab running daily?
Yes, it is.
They ran over the weekend also?
They typically have tried to take Sunday off, but I think they actually ran Sunday this past Sunday. So I think they're pretty much in a 7-day-a-week operation right now. But just go back to the number. So statewide, 13,235 tests have been run. Again, this is off the Department of State Health Services website. 1,758 public health lab tests, 11,477 private lab tests. And if you run the numbers on that, if you look at the cases, and the confirmed cases kind of run the ebbs and flows, but just as a general rule around what I'm hearing around the country, the positive cases are running anywhere from 5 to 10%.
George, what's the testing capacity in East Texas right now?
Typically, they can run up to 50 lab tests a day at the FLET lab, and depending on the situation, they can do up to that. But a lot more of the testing is being done through the private labs now, as you heard from these numbers. And I think you'll see more testing done across Texas as the private labs become up and ready. There also, if you may have heard, and we talked to you all about this last Saturday, there's a point of care test that's now is coming available. It was approved by the FDA on Saturday. So we expect to start seeing those tests out. As I understand it, the point of care tests are going to be run first for people who are inpatients. But those tests, so you're seeing the testing capacity in the state of Texas start to increase.
What's our breakdown between what's been confirmed positive by the public health lab and what's been confirmed positive by the private labs?
I don't have that. I can get that off the top of my head.
We've heard from many people who are somewhat frustrated that they cannot get a COVID-19 test. To those people who are going in and they say they have all the symptoms, we now know there is evidence of community spread and they can't get the test. What do you say to them?
Well, I think right now, number one, you need to be seen. So just because you think you need a test doesn't mean you necessarily get tested. First of all, your provider needs to determine that. So that's step one. Once the provider does that, there is a step-by-step process that is outlined by the CDC and Department of State Health Services that we must follow in my organization to do that, the public health lab test. The commercial lab test is a little bit different, and it depends on if you're through a hospital system, through a private provider. I think, but again, they're going to be looking at your symptoms of fever, cough, and shortness of breath before you do that. Again, the lab testing early on was, before the commercial labs became available, was pretty, it was more difficult to get. And even going back 3 weeks ago, our public health lab here in East Texas was not even open and available to do these tests. So just in the last roughly 3 weeks has our public health lab been able to do that. Before that, all tests had to go directly to the CDC.
It appears several hundred, if not more than 1,000 people at Train have been exposed to a positive case. How are they able to reopen this afternoon?
I can't really respond to that right now. But the only thing I can really say to that situation, again, Train is the one that would need to respond to that. The cases, whoever the employees were in that situation that was COVID positive, according to the press release, we'll do contact tracing of that. So it'd be the people who were, in close proximity to that person would be, we would do contact tracing on to see that. So I understand that Train is, according to press releases, sanitizing last night and today.
George, as the local health authority, at what point would you suggest to city and county officials to do some type of a mandatory order making people stay at home?
Sure, I think that as we watch the test again, that's part of the conversations we're having daily, if not hourly, Blake, in those situations. So that we were, as the mayor mentioned, who's to my left here, it's constant consultation between the mayor, county judge, the health authority, and myself.
And so collectively, the decision would be reached among you all. It
Correct.
wouldn't come directly from you.
Correct. It would be a collective decision.
I know you guys are saying that people should social distance, but it's hard for people who are working in those stores that we're talking about.
Correct.
Is there any other advice you have for them to stay safe during this time?
I just say, the store, whatever you can do to try to maintain that social distance and really encourage, that's where too, we go back to the community itself. So I speak directly to the community at this point. If you are sick right now, regardless if we have you should stay at home, a shelter in place, or whatever we say, if you are sick right now, please, please, please stay at home. Do not get out and potentially affect your other peers in the community. So, but in those situations, again, with the store employees, if they are sick, they need to stay home as well. Whatever we can do to limit the spread of this thing. And again, why do we maintain 6-foot social distance? Because if I'm speaking, if I'm coughing or sneezing, that respiratory droplet would travel roughly 6 feet. This is how this disease is spread, is through respiratory droplets.
Is there any suggestion from Net Health to the city to maybe sanitize parks a little more often, things like that? Because people are at home now and they're trying to find things for their kids to do, so we're curious.
Sure. That would be, Mayor, if you can speak to that.
I believe I can answer several of those questions. Yes, we are increasing sanitizing. In fact, we have several community businesses that are volunteering and helping us on that right now. Our logistics crew is working on that because we do understand. But now, if you're at a park and you're having the kiddos on all the slides and all the other components, we need social distancing. So definitely use the outside spaces. But when you do that, we're not talking about a bunch of people getting right together and playing on the slide, right? Let's all just use great common sense and courtesy. And let's make sure, if you have some of your own wipes, take them. Wipe up after yourself at the park. We're going to be doing the best we can to do it. But again, it's got to be all of us in this together. And one thing that I do want to stress, and that is some terms that I've learned about persons under investigation or testing, right? If you're one of the people that is getting a COVID-19 test, do not leave your house. Only go, call your provider, and show up when they ask you to show up. But do not leave your house. Your family should be quarantined as well. Do it self-isolation. If you think you have this disease, don't go in public. There are friends that will deliver necessary items to your house. But the extensive contact tracing we're doing, you also, if you think you have COVID, not only should you stay home for 14 days and talk to your provider, talk to one of the hospitals, anybody you've come in contact with over the last several days, you can do the contact tracing before we do it, or before the Northeast Texas Public Health does it. Pick up the phone, say, hey, you know, I'm feeling really kind of sick right now, and I'm sorry I put you in this situation, but you have to self-isolate your family. We don't need people, I mean, community spread. It's not a rocket science term, right? I mean, it's spread from people that have it to someone else. So let's really focus on that message, and that's why we're focusing on the social distancing, washing your hands. This is what all the professionals have told us will solve this issue. But if you have it, you think you have it, stay home. Call your physician or call one of the 2 hospitals, and the PSA numbers will be out consistently through y'all's media.
Mayor, the cases in Smith County, can you tell us how many are people who live within the city limits?
You know, I'm a mayor, right? So this HIPAA stuff, I don't get it. I mean, for me, I'd love to just say a lot.
So, George,
but-
can you explain to us
so-
why other municipalities are able to do that, but we're not allowing ours to?
I'm sorry.
Oh, I'm sorry, between the city and the county?
No,
Or
so
just-
other municipalities are narrowing things down, saying, we've got a case in Frisco, or we've got a case in Plano. Can you explain how those counties are able to do that?
No, you misunderstand. We can say how many are in Tyler and how many in Smith County, but we also didn't want to provide confusion to the public by saying, oh, you might have one in this city, in Smith County, you might have one in city. Because as I said earlier, Tyler is a location where everybody in Smith County is coming. So we felt like it's better just to say, I mean, it's Smith County numbers, instead of saying there's one over in this city or one over in that city. Because we have to, this operations center, and the public needs to know it's a community spread. That's the main thing, right? And so to detail the exact location of someone is the HIPAA stuff that I understand that he is not able to share, and I'll let him answer that. But what's important is if you think you're sick, you need to self-isolate. And if you're a person that has had a test, you need to be at home with your family or in the hospital in the care of a physician. You don't need to be out on the streets, okay? So, but I'll let him answer HIPAA stuff.
Mayor, to be clear,
Sure.
to the many people who have asked us, it's not because you necessarily can't tell them where these people live, but because you have chosen not to.
Pardon me?
You mentioned that.
No, there are HIPAA rules that I don't understand.
Yeah,
I'm not,
I'll jump in here. Thank you. Let me.
Yeah.
So, okay. So one of the things that we want to let's talk about HIPAA. HIPAA is the Health Insurance Portability Act, and basically that's how we talk about the privacy thing. So you've asked the question before. You know, why are we being so discreet about that? Should we say? And the reason is we don't want to. If somebody wants to say that they have it, if they want to tell you directly that they have it, that's their choice. But I've had a lot of people, I've even had folks who were diagnosed, I've had issues of gratitude for me not saying or giving any kind of information so people could figure out who these people were. I will tell you, the staff pointed out, because I couldn't answer your question directly a minute ago, 13 of the cases is the city of Tyler. However, I'm not going to go further than that because, again, you get to the smaller communities, it's easier to identify. So that's, again, it's my job to try to maintain people's privacy, and I'm going to stay pretty hard and fast on that. But elsewise, 13 is not as easily to identify maybe as people in Tyler as it is the other municipalities. So we'll say 13 of the 16 are City of Tyler.
What about saying like a male in his 70s? That wouldn't identify anybody.
Well, we can say, I can tell you, like I've given you the demographics on the person that passed away. Again, the person is deceased now. I said 91-year-old male, Smith County. So we've given you a tad more on that. Again, I'm trying to maintain, I understand the pushback, but we're trying to maintain people's privacy.
Okay, well, let me. Okay. I know that there's a big fascination on y'all's part on wanting to get to the correct person and get to the neighborhood, exactly where it is. Y'all stop. Okay? We have contact tracing, we have professionals that are working, all day, all night doing this contact tracing, okay? You don't have to know an individual's name, okay? What we have to do is talk about the social distancing, wash your hands. We have a responsibility as a community to stand up for one another and do what's right. We don't have to know the damn name, so slow down on that, okay?
So we're not asking for a name, but community is
So-
releasing this information. Highway train, a very large subdivision.
Absolutely.
And
That is we're not going to do that. That is, if they want to release that information, that is their business.
And Mayor, I'd like to be
Yes,
clear that
sure.
these questions are people who are asking us.
Oh,
This is the
sure,
number
I-
one question
I-
that people in Smith County and Tyler are asking us. And so we just want to make sure that they have an answer.
The answer is, we are contact tracing 24/7. We are speaking to anyone that has any connection to anyone that's either has tested positive or is taking the test. We are working diligently and imploring everyone to stay home and self-isolate if you're that person.
Mayor, can I say something?
Sure,
What
you're
about
welcome.
those people in the smaller communities that don't have the big grocery stores that we have, that they can't curbside pick up? They're not able to social distance as much as we can in Tyler if you choose to. Is there any thought of informing those smaller communities? Because they might not be able to protect themselves.
The smaller
without that
communities are part of the Operation Command Center. They are in contact with us, and we are working with them with any item that any of the small communities around here. For example, the planners and the logistiks of the Emergency Command Center.
May I respond also to that briefly?
Sure, yeah.
Just briefly, as it relates to the question concerning the outlying communities, I want you to know that beginning last week, I've been holding periodic telephonic conferences with all of the mayors that are in the outlying cities, and I'm in constant communication with them to alert them to any issues that they may have there. I just want to let you know that from the county judge standpoint.
And Mayor, County Judge, for those who are concerned, because it's not so much who, but where, for people who are concerned about whether they have been in the stores they've been in or any type of contact at all, can you tell those residents that they will be contacted if they happen to come up with in-contact tracing?
Here's what I can tell you about that is that, as the mayor said, the joint efforts of the Northeast Texas Public Health District, the Smith County Sheriff's Office, and the City of Tyler Police Department are doing contact tracing immediately when we have information that we can act on, and we're contacting as many people as possible to make sure that those folks that may have come in contact with someone that tested positive are in fact notified as such. And so we're doing the best we can. What we would ask for is cooperation on the backside for anybody that has been tested, to make sure that they give us full information once they've been tested positive, to let us be able to trace down their steps as much as possible. But the more important issue here is on the front side of all of this, as the mayor has emphasized, keep social distancing, wash your hands, practice good habits, and respect your neighbor in all of your interactions. As I mentioned in Commissioner's Court yesterday, if we treat every person we come into contact with as though they may be a COVID carrier, then we're going to behave differently. And if we do that and behave in an appropriate way on the front side, that is the most important thing we can do at this point to prevent further spread. We're going to do our best on the backside of positive tests to track down those folks and to let anybody that's come into contact with them know. But that's something that has to be centrally done through the Northeast Texas Public Health District, and there are those HIPAA guidelines in place.
And Judge, you mentioned in Commissioner's Court yesterday something about sheriff's deputies helping out with contact tracing.
That's correct.
How's that working?
It's working great. We have both sheriff's officers and City of Tyler PD officers that are working in conjunction with those at Northeast Texas Public Health District to make sure that we have enough manpower to get to the individuals we need to get to as these cases continue.
And it's working very well.
And city officers are a part of this as well.
Yeah, both the city and the county are helping us with this, and we're grateful for both the city of Tyler and Smith County for their assistance in that process. The mayor and judge just mentioned something very important in this whole process here too. You asked the question about the parks. You asked the question about, what can we do? Number one, the parks, I think, with moms and dads and kids, carry the hand sanitizer with you. Make sure they're wiping their hands. And I think the idea, because the city staff can't be out there 24/7, they're going to do the best they can, but the next kid may come along after they've been there. So take your Clorox wipe, take something with you, maybe to wipe the slide or wipe the handrails down or something like that. But again, if you think you are sick, or maybe you think you've had a test for COVID-19, please stay at home and do not get out and mix in with the public. It is imperative that people do that. They have to I said this is a team sport. So again, if you're told that, or maybe if you're sick, number one, but even greater, if you've just had a test for COVID-19, it is incumbent upon you to stay home and self-isolate.
So we don't have as many cases, obviously, as like Dallas County.
Correct.
Quite a few.
Right.
But we are also a smaller area, so I'm curious if you guys have looked into the per capita, infection rate. Is that something that?
Yeah, that's a metric that we're going to look into. That's a good question.
Is there a theory why we've got so many more cases, even though we're not part of a major metro area?
I've seen like some of the stuff along I-35. I think, again, Tyler's we're kind of the major hub between Dallas and Shreveport. People travel. We've had, people, our first 3 cases were travel related. So there's a lot of travel that comes in and out of Tyler. People live here that may work somewhere else. So I think that, we're just we're larger than our area is considered rural, but we're really more of an urban center because we're the tertiary center, medical referral center really for all of East Texas. So I think that's probably, perhaps one of the answers there.
So we've got people on the live stream concerned about grocery stores like Sam's Club, where people are continuing to have lines outside the store. Is there a mechanism to step in and maybe help them create?
Sure. You want to respond to that, or Judge?
You want to answer the question?
Mr. Broussard, you may answer your question.
Is this my question?
That's your back.
So,
Come back.
we can't always hear the questions in the back. We can hear so what was the question?
Zooming in on my live stream over there.
Oh, that's okay.
So we've got people that are concerned about grocery stores, like for instance, Sam's Club. There's still lines outside the store for people making a run on toilet paper. Is there a mechanism the city can use to step in and help them kind of create a buffer zone?
At this point, what we're trying to do is, as far as the retailers, is education. Remember the social distancing. The social distancing was part of the governor's order. Remember the fact that you want to try to control the number of people that are in your location. 10 people in a room, as we have demonstrated over and over again in here, that you're trying to restrict that to. Now, for a big box, as we looked at as far as square footage and the amount of people in there, you can take, so for example, Home Depot. Home Depot, based upon their occupancy load, could fit probably 1,000 people or so in there. They currently have a sign out. They're not allowing any more than 100 people in Home Depot at this point. That is a good example for our larger big box retailers on how to control that. And that's where we've had our assistant police chief and other members of our police department visiting with the managers at these different facilities to try to figure out how can you do more crowd control in those. So we're talking about the grocery stores, we're talking about Sam's Club wholesaler, we're talking about sporting goods. We've seen in sporting good locations quite a few people, large crowds at the sporting good locations. And also then, as I mentioned a minute ago, your hardware and your home needs type places. So your Lowe's, your Home Depot, those type of places where we see crowds. We understand it. People want to, if they're at home, they're doing work at home, but also they're like, well, I want to tinker, I want to do some other stuff at home as well. But they are also going to be sick at home if they are not careful in doing things to better as far as take care of their health. As we emphasize over and over again, this disease is highly infectious. You catch it in the air from the people that you are walking around. You catch it from the things that you are touching that they just touched when you were at the store. And so our retailers, we want them to do everything they can, and we are helping them be able to understand what some of the things they need to be doing in order to improve their conditions, but also to those people that are there using their stores, as has been repeatedly mentioned over and over again. If you don't need to be there, don't be there. If you, for whatever reason, are going or have to go, make sure you are doing everything you can with as far as hand sanitizers, making sure you're keeping your social distancing, because if you are not, you will contract this disease and you will spread it to other people.
And let's say a business is found to be not, abiding by what the city has suggested and recommended and told them to do. Would the city then take steps to enforce that at that particular business?
That's one of the interesting pieces on this, and that's part of the reason for the message you're hearing today from the two top elected officials in this county and city, from your health department, from as far as the chief medical officer for this community, is this is an opportunity for you to fix this before further restrictions and mandates have to come down. There is an opportunity here for we as a community to come together to be able to have to do this without policing powers, then having to enforce stricter rules. And so this is that opportunity for those retailers to help adjust and work towards this problem and fix this problem before we have to take steps to address it for them.
And while we've got you there,
Yes, sir.
the state Supreme Court put a limited moratorium on evictions during this time period. Is there anything the city can do to help residents who, say, were working at a restaurant and just lost their job and are still being threatened with eviction?
So on the eviction piece, the city typically doesn't get involved in, when I say typically, we don't get involved in eviction procedures. So actually, I don't even know how to start answering that question, because that's actually going to be under other court powers. It may be something that the sheriff's office can perhaps better address. In fact, one of the things is maybe Judge Moran who's right there. So let me actually turn it over to Judge Moran, because Smith County is going to have greater participation in this than the city will.
Corey, your question related to specifically economic assistance, I believe, for those individuals. What I anticipate is that that's going to come from the federal and the state government. Economic assistance, at least on the county level, typically does not come out of a county budget. What we are doing is we are adhering to the guidelines that have been put out by the Office of Court Administration for our court proceedings, and also from the Texas Supreme Court for holding off on evictions. That happens through our JP offices and our justices of the peace throughout the county. And we're certainly going to abide by that. And we will do our best as a community to gather as we move through this process to determine really what solutions need to happen on the back end of this. But I anticipate that what you're going to see is a whole lot of folks that are going to need to join together to recover together. And luckily we have a strong and resilient community, and one that I'm certain is going to get through this process just fine if we take personal responsibility to do all that we can now to prevent the spread of this disease when we can do that. I'm going to leave the room. Oh, Mayor Hines is going to conclude the the press conference, and I'm going to give him some space.
Can I ask one more logistical question?
Sure, yeah.
Do you think that they'll be doing more, or is there a plan in place to possibly do a little bit more trash pickup, or have you heard about that? Because we've been getting calls from people saying that theirs are overflowing because everyone's home.
Well, that is a good question, and we will bring that up with the city manager. That is an item that we might be able to modify. That's a good point. Thank you for that question.
And Mayor, also, would there ever be the chance maybe that there would be a city-specific order for shelter in place or stay at home that would be separate from maybe action taken by the county?
The county and the city are going to be lockstep in what we do with the health department, with the hospitals, with the governor, the independent school districts in our area. We're all working together. We're going to function together. The worst thing in an emergency is for different messages to get out to the community, right? It's very confusing times. It's a very stressful time. You don't need government increasing your stress. You need facts, not fears. I think that the Joint Information Command has got hashtag share facts, not fears. So it's really important that we're all together on this and we're communicating as one. It is very apparent to me that through all the planning, we are ready to serve the public. And we are serving the public in so many ways at this time, and we are ready. The hospitals are ready, we're ready. Let's pray that we don't have to be ready. But the only way we can solve this is East Texans caring for themselves. We have to love and respect each other, and that means social distancing. Wash your hands and clean surfaces. It's very important. Government can't tell you to do it. It's in our hearts. It's in the people we are. We know what we have to do. Let's do it. And I will tell you that on our side, when it gets to the contact tracing and all these issues, there are hundreds. At this point, there are thousands of people in your community that are prepared to help. So let's work together as a community. And on Friday at noon, we're going to do this again to make sure that y'all have an opportunity to ask us any questions. We have an opportunity to provide a message to you on where we are in the process. It changes very quickly. But again, I'll say, because of all the work we've done at the Emergency Operations Center, we're ready for any scenario. And we are here, and we're working with these great health care professionals and our great public health. So thank you very much for attending today.
Thanks. Thanks, guys.